My name is Dr. Kahl Goldfarb. I'm the owner of Water and Sports Physical Therapy. I am a physical therapist trained, but after PT school, I felt there was more to learn, and I went back for a postgraduate doctoral degree in orthopedics. So that's basically any kind of musculoskeletal injuries and any kind of sports injuries. So I've sort of tailored my practice to focus on any kind of injuries that occur in the ring, such as MMA, or any professional sports, or any injuries that occur from the weekend warrior. Just about every joint we've seen. I think that's the issue with MMA.
Right.
There's two different types of problems. There's a trauma and there's an overuse injury. I see with the MMA athletes it's usually a trauma. So usually we have ligament issues. You know, you stress or strain a ligament from being in a lock. You could maybe possibly tear cartilage from excessive strain and stress during either a fight or during practice. We find the muscle tears, tendon tears, but they go through the whole body. The shoulder, the knee, two major issues that we find popping up over and over again, and the elbow. So there are some things we try to do to try to decrease the stress in those areas. So we call that prehab. And we look at exercise that we can do to help prevent the trauma. Now, if somebody hits you in a certain position and it causes a trauma in that way, there's nothing we can do about that. But if somebody puts you in a position where you can't get out of, and that all the stress has to occur at one joint, on one ligament or one tendon, that's when you're going to have this bleeding and an inflammatory process of that problem area. So what we try to do is, instead of just strengthening that joint, we try to look above and below how we can mobilize, allow enough motion above and below that area that's stressed, so it can take the stress off of the knee or the shoulder or the elbow when you are in a lock or a precarious position. I think what I've seen being missed, not by you, but by some trainers out there, is they focus on the larger phasic muscles, the big muscles that move and push. What we miss sometimes is the in-between areas. So, for example, the thoracic spine, thoracic mobility. A lot of fighters have a lot of mobility through their joints, but their thoracic spine does not. Their hip does not. So if we wanted to work on some exercises to focus on thoracic rotation, hip mobility exercises, those two areas would be a lot of benefit. So if somebody does grab your shoulder and puts you in a lock, you're able to not only move through your shoulder, where you only have so much range allowed, but you move through your thoracic spine, you can move out of that position. And the more stability you have through your thoracic spine, the more stability you have through your shoulder. So it helps in two ways. So the way I look at it is trying to combine a mobilization exercise and a motor control or stabilization exercise. Put them both into one exercise. So if we were going to work on the thoracic spine, what I would think about adding into the program would be putting somebody in prayer position. You can have them with their arms centered in the middle, with their other arm behind their back, and rotating as far as they can, trying to use their mid-back as the fulcrum point and trying to use the muscles back here to move through your entire range. Quite often you'll see people have limited range. Sometimes it's because they're tight, and what the trainer would do is grab underneath, through here, grab the shoulder and see how much motion they have and see if it's a weakness, which, believe it or not, most people have a weakness in the thoracic spine. So rotate as far as you can. If the person gets to here, grab, wrap your arm underneath and pull and see if there's more motion. There shouldn't be more than a 10-degree difference between what they can do actively and what you can pull them passively. So if they get to here and you can pull them much further, they have to work on strength and motor control. So they do tons of rotation exercises. You could add in arm above the head, start having them do exercises where they're reaching different positions. So you're stabilizing the shoulder and mobilizing and stabilizing the thoracic spine. So it's important. I've noticed the toughest athletes I have are our football players professionally and our MMA athletes, because you guys are taught to live with pain. And I'm not a fan of that, because pain is your first sign of pathology, which means that something's going on. You can like push through it, but if your rotator cuff and your shoulder is not stabilizing, what's going to happen next? You're probably going to tear your labrum. You're probably going to tear cartilage in your shoulder. So I think you need to use these signs that don't go away within a week to 2 weeks maximum. Use those signs, the predictors of future injury. It's going to linger on, especially MMA where you're in all these different positions. You're stressing the joints and ligaments and tendons past their normal range. I would get that looked at as soon as possible. If you know what it is, then I have athletes all the time that come in and say, hey, this is killing me. We'll find out, that's just muscle or tendon, no problem. Here's what you do. Here's what you try to eliminate, avoid this couple positions. Here's your exercises. So at least you know what the problem is.